What's up, beautiful people? Another day, another study. As a internal medicine physician who's worked in the hospital and in the clinic, gallstone disorders and diseases are something that I've treated frequently, whether that was the emergency situation of possibly needing your gallbladder removed or just dealing with aches and pains from flare-ups. It's estimated to affect 10 to 15% of adults here in the US, and we know that metabolic conditions like diabetes, obesity, insulin resistance increase the risk of gallstones. And there's been a growing trend in the increase in gallbladder disease and metabolic syndrome, both in US adults. And this study sought to examine and expand upon that knowledge by looking at metabolic disorders such as fatty liver disease, diabetes, obesity, hypertension, hyperlipidemia, and hyperuricemia. We've talked about pretty much all of these things on the channel before. This was a cohort out of the NHANES and had over 6,000 participants. And they found that in general, people with gallstone disease were less physically active and were more metabolically diseased than those without gallstones. In the fully adjusted model, participants with fatty liver disease, obesity, hypertension, and diabetes had between a 52% and 73% increased risk of having gallstone disease. They didn't find an association with hyperlipidemia or hyperuricemia, but almost 80% of the population had elevated blood lipids, so that might have obscured if there was actually an association there. But this is another in a long line of studies that reinforces the importance of metabolic health. Although this was cross-sectional, a snapshot, it aligns with what we see in the literature that metabolic disorders are associated with a whole host of other chronic ailments, and comprehensive assessments and health plans are necessary to really combat the chronic disease epidemic of today. And a lot of the chronic diseases and their manifestations we're seeing are associated with our worsening metabolic health.